Okay, welcome to this first workshop on scenario planning looking at COVID-19 vaccine introduction. So this is obviously a very exciting topic, one that I'm still looking for Charlotte. Let me just check. Yeah, so when we developed exercise 2 in the peer hub, we thought that we would get there to the point where we would be looking at how, reflecting on your experience, how you have faced vaccine hesitancy and moved individuals or groups to acceptance in the past would be a good way to get everyone thinking and getting, in a way, preparing themselves for the challenges of hesitancy and demand promotion and community engagement that you're likely to face today. So we, as you know, Susan Mckay participated in the 23rd of November. I see at least one scholar team. Let me just, scholar team as co-host, and then, yeah, let me see. I still don't see Charlotte. All right, well.
Yes, sir. Hi, Reda. It's me.
Oh, okay, your scholar team. Okay, great. All right. Yeah. So in thinking about this, this business around hesitancy, we thought this would be a good setup. Would be that the case studies are really about getting you to think and reflect and learn in a new way. So looking to global expertise, but also valuing your own experience. That what you know from having been confronting hesitancy and successfully engaging people, moving them from hesitancy to acceptance, that's a good place to start the discussion we're hoping to have today. Now, Susan Mckay wrote to me this morning and at or late morning to say that she actually had a medical issue and had to go to the doctors. She nevertheless, so she asked what we could, what we could do. We offered to postpone, and we arrived at the decision that we would hold the workshop today. She is going to try to join. It is not a medical emergency, but otherwise we wouldn't even have asked. But she has, so she may be joining sometime along the way as we work together. But actually, this is also an opportunity to get our ducks in a row. I'm going to show you what I mean, just starting the discussion. So some of you working, especially if you're working at the national level, are probably already involved in the, okay, here I see Francois, are probably already involved in the, in the vaccine 19 introduction preparation that your country is doing. Others may be hearing about the introduction of COVID vaccine in your country for the first time. So we want to, let me see what's going on here. Yeah. So we want to start the discussion, and would like to do so with these questions. Now you're all familiar with how this works. Let me just get Francois in the as a co-host. Oops, yes, and then let me see if Sarah. Yeah. All right. And then we'll be looking for Susan Mckay if she is able to join us. If not, then we will have another session specifically with her to get really the guidance and the picture from GAVI. So this is what we'd like to start with, all right? And we're going to ask, as you know, as you're familiar with the process, for either raise your hand. All right, I see Udoji Danjuma has already raised their hand. So let me ask, Udoji, let me ask you to unmute.
Hello, good morning, good afternoon, everyone.
Yes, good morning.
Yes,
and good afternoon.
I'm Danjuma Udoji from Gusau, Zamfara State, Nigeria. I'm now presently the WHO State Technical Officer for measles and yellow fever. And based on what we have today, I would like to share my own experience and what we have. So actually in the past, I've been involved in vaccine introduction. I was a facilitator in introduction of IPV. and also PCV and Mckay as well in Nigeria, and even in Nigeria in Kaduna State in particular. But in the aspect of COVID-19 vaccine, it's not yet, so I'm not much involved in it. Likewise, at the national level, I'm not a part of it because my work is at the state level. Um, the most challenging thing in Nigeria that I think will be a problem to us is the cold chain maintenance for the COVID-19. Looking at the temperature rate, which is from -80 to -40. So even for the other vaccines, there are many situations that we fall apart where vaccine will exceed the normal temperature. So dealing with COVID-19 in Nigeria, looking at the temperature, I think is something that we need to, that will be a challenge to us. Not only that, based on our cultural and also the behaviors, most of our people here do not believe in COVID-19. I think this will be a major setback when we start COVID-19 vaccination. Then the availability of the vaccine to some places, looking at our terrain in Nigeria, is something that we need to battle with. And not only that, most of our people here, we have that fear of side effect of vaccines. If peradventure anything will happen with one or two, it will be something that will create fear, that people will not look at it on the positive side, in which it might bring fear. And because of the what happened with the outbreak of the pandemic of COVID-19, the stigmatization of being vaccinated with the COVID-19 vaccine will also be a setback in Nigeria, because this is something we suffered with in polio eradication. So in COVID-19, I think the stigma of being vaccinated with COVID-19 will also be a setback that we need to fight it up, believing that we'll make our way based on the experiences we have. Then the challenges we need to look into again that we are facing in Nigeria is our religious and traditional institutions, in which we know, based on the previous experience we faced with vaccine hesitancy in polio eradication, some of our institutions, that is religious and traditional, some people use it as a way of gain. By creating hesitancy, then things will fall in place for them to get what they want. So these are some of the challenges that I know we are going to face. Then in respect to vaccine hesitancy and the demand for population and community engagement, I think we are much prepared. We are much prepared in terms of the vaccine hesitancy, because we have so much experience, and now because of the strategies we have in social behavioral change, we are ever ready to promote demand in our population, and also to involve communities, so that this hesitancy or problems that may arise can be solved in preparation for the vaccine COVID-19 introduction in the mid-2021. Thank you.
Thank you very much,
Over.
Danjuma. So as I explained, for those of you who are joining late, Susan Mckay sent me a message this morning at 10:30 to inform me that she actually has a medical appointment. So fortunately, it is not a medical emergency, but that is going to make it difficult, if not impossible, for her to join. So what we're going to do is we're going to collect both your responses to the questions you see on this on screen and any questions, concerns, reflections that you have about what COVID-19 vaccine introduction is going to look like for you. So unless you are involved at the central planning level, working with the national
Hello.
vaccine deployment plan, if you whether you work in a district, in a health facility, wherever you work, you tell us what do you think this, the day you receive the instructions and the vials or the the containers for the vaccines, what do you expect? What do you think the challenges are going to be? That is what we are interested in. So for Udoji Danjuma, I think you already answered this question. So from this list of sort of 13 in the sequence of that goes into a vaccine introduction, which of these would you say is likely to be the most challenging?
Yes, I think the most challenging one that I will have interest most is on the issue of lack of government policies that will promote uptake of the vaccine, because we know the devastating effect of COVID-19. We need government policy that will enforce or that will give priority to the vaccination of COVID-19, maybe across government facilities, our schools, and other places that requires gathering. And by doing that, I think government policies should give priority in enforcing COVID-19 vaccination. These are my take.
All right,
Thank you.
thank you. And I suggest, so I have two suggestions to make. One is that we hear one presentation responding to to these five questions from each country. And second, that if you are a country team leader or an active member of your country team, that we will share this slide deck and would like to encourage you to use this slide deck to explore these questions with members of your country team. So let's go to Dr. Vinay Kumar. Thank you, Udoji Danjuma, for your contribution. Thank you very much indeed.
Thank you,
Let's go.
Dr. Reda.
Yes, Dr. Vinay Kumar, the floor is
Yeah, yeah. Hope I am audible.
Thank you.
loud and clear.
Yeah. Good evening, all. Good morning, good evening, good afternoon, whatever applicable to your area. I am Dr. Vinay Kumar. Since 21 year, I am associated with a vaccine implementation, vaccine management. As a vaccine manager, I am working in my country. So I have been witness for many vaccine implementation and process. Right from the, you can say very recently, we have introduced a switch from the trivalent to bivalent, pentavalent, as well as MR campaign, uh, and other vaccines also in a sub-regional level, that is a JE and PCV vaccines in some part of in my country. As second question is, what is my involvement in the COVID vaccine introduction? Yes, very much, very active preparation is going on, and our country, India, is planning on a software-based to track each and every dose of the vaccine, and we are on a emergency mode, and we are preparing the whole things, and we are not waiting for what is a good correct thing, that we are not waiting for a vaccines. We know that the what are the challenges, what are the that what are the operational guidelines for implementing vaccines and other things. So only rest of the things will not be imparted in a will not be covered in a training. Will be what vaccine will come, what will be the dose, and what will be the temperature to maintain that. But likelihood we have that we will go with a 2 to 8 degree temperature, any vaccine, any candidate which is coming, and providing us coming in a 2 to 8 degree temperature. And we have also indication that we are going to have a multi-dose vaccine. So this kind of things. So right now we are very much involved in developing that training modules has been developed. All guidelines has been developed, So I'm talking of uh, talking about India. I'm sorry. So that is the thing, and so we are going with in a election mode, as our country is a large democratic country. So we are very much trained of doing these things in election mode. So that will be the things, and every person will be checked, their identity will be checked, and through that software based we will vaccinate candidate, and the real time data will be picked up, even including AEFI also, even minor AEFI we are going to pick up, and we are also going to have a massive training to private doctors also, just to pick up. We are putting all our effort to pick up early signal if anything related to vaccine is there. So that is one thing. And right now, since last 4 5 days, we are involved in a different level of trainings. National training has been completed, administrative trainings is also going on, and so now we are cascaded training we have already started doing this. uh, as for our challenges are concerned, so there are challenges, certain challenges. So as we know that there are three category as for us. So there will be one group that they will be having a vaccine hesitancy. So that is there for all country, and there at another end there will be vaccine eagerness also. So both thing we need to be balanced, that we are forcing, these are the problems this can come, so that we are also taking help from the police and home department also, to just to manage, just to, as because we are going in a phase manner, so there may be a pressure from a community, they will also ask to vaccinate. Our phases are like that, for in a first phase we are going to give a vaccine to on first we are going to vaccinate our healthcare workers, including government and private, and then we are going to give a frontline worker, including a police and all personals. And third phase will be like a person who are above 50 years, and final phase will go for a less than 50 years of age, but having any comorbidities. That is the plan right now, and we are working on that very much. So there will be third kind of things that many of the people, they are not realizing the things, but we are struggling. The third challenge will be the one group, a larger group. They are silent people, they are neutral people actually. So they will not come to, neither they will refuse you, neither they will come forward for a vaccination. So how, and this chunk is a very big chunk. So they need a push, they are just screening each and every media. So we should not go only with that we are perceiving that all people will come to our booth and they will take this vaccination. So that is not going to happen. So in that condition, this major chunk of neutral people, they are they will require a push from the government and positive news. So that also we are you are perceiving that can happen. So and another challenge is first time we are going to have a software based, and this kind of picking is that this India is a 1.3 billion country. So having a records of this all person and this beneficiary. So software has their own challenges, and we have chosen to go with a software based things. Right now it's working fine, data has been entered, and we have a dry run also in some of the states, and it's working fine. So that is a right now plan. So we are just waiting and hoping that end of the December, or even before that, we will get a vaccine, and January will be the certain time that we will start inoculation of this vaccine. So thank you very much, Reda, for providing the opportunity to speak in this forum. So if any question is there, you can ask me. Thank you from my side.
Dr. Vinay Kumar. So again, just to recap for those of you who are joining late, Susan Mckay had
Yeah.
medical
I was in process.
was not able to join us at the at the original time. She's just sent me a message to say that she is on her way and will be joining the workshop as soon as she can. So what we're doing is we are recording your presentations and we'll share them with Susan and other partners from WHO, GAVI, and so on. Again, we're only asking you to speak about what you know and what you're able to ascertain from where you sit. So if you work in a health facility, we're not asking you to imagine what COVID-19 vaccine introduction looks like from the capital. Tell us the day when you get the instructions and the vials to actually start delivering the COVID-19 vaccine. What do you expect? What are the challenges you think that you will face? Dr. Vinay Kumar, of these 13 challenges, which one, in your context, do you feel is going to be the most challenging one?
Okay, so let me read that. COVID. So I think we have foreseen these challenges even beyond this, whatever enumerated here. Actually, that is not fitting. Actually, we are going with a software base. So that is the main problem that we are forcing. Okay, what will happen? We don't know. Actually, the vaccination will start, and during that, whether that everything will come. Unless until you are not matching with that beneficiary, if name is not there. It's not coming in a mobile phone or whatever data source is there at a vaccination site, that person will not be vaccinated. That is right now the communication that we have. So suppose in that case, if software is not working or server is not working properly, in that case we will face a lots of problem. As because this is this whole thing has been transferred to a digital mode. Even the micro planning and everything is there. So that is one thing. Otherwise we have planned very nicely for a vaccine distribution, and this training program and AEFI portion also. Another challenge, Rita, I'm seeing that AEFI challenge will be there, because we have never been witnessed of vaccinating this much of large population, and comorbid people also. So we know that from each and every district we are getting 50 or 55 average death mortality, natural mortality happening. So these people may have these natural death may coincide with a vaccination also, and it will create a huge AEFI cases and huge public concern, and that will give fuel the anti-vaccine lobby to fuel their rumors. So that is one challenge that right now we are looking forward. Okay,
Right.
Rida.
Thank you. All right. So so we know that you're only speaking about your specific context unless you work at the national level, in which case we do expect you to share for the entire country. But we have now heard from the two largest countries in terms of geography, from Nigeria and India. So I would like to ask you to raise your hand only if you are neither from Nigeria nor from India, just to create space for from as many country perspectives as possible. Fateh Asmatullah, are you okay? So yes, so let's go to Josephine Owusu-Yeboah.
Hello, good afternoon. Please, I hope I'm audible.
Yes, loud and clear.
Yes, good morning, good afternoon, good evening to everyone. My name is Josephine Owusu-Yeboah, and I'm speaking from Ghana, specifically the western part of the country. And for what I do, I'm the EPI coordinator, and I work at the district level. And to start with, I'm very grateful for the opportunity to share what we are expecting in the introduction of COVID-19 from where I sit from. Yes, I've been involved in introduction of new vaccines, such as the introduction of the pneumococcal conjugate vaccine, the rota vaccine, the switch from the trivalent to the bivalent vaccines. And since I've been in work, I've been involved in introduction of new vaccines. And some of the difficulties that we face whilst vaccines are mostly introduced are the acceptance rate, because for every new thing, people resist. And so we need to always engage the public very well so that they will come into terms with the new things that we have introduced, because they will have a lot of questions for the healthcare workers, and we need to always work on what they are facing or their challenges. So these are some of the challenges that we faced when new vaccines are being introduced. So it takes a longer time for the general population to come to terms of the new things that we have introduced. It's not always that smooth, but at the end of the day, from hard work, we are able to convince them. And for involvement in COVID-19 introduction, I don't expect it to be rolled out in my country now, but I also expect it here. Whilst there is COVID-19 vaccines around the world, I'm sure Ghana as a country will also be expected to also introduce it. And so I'll be expecting it. For my involvement or my role in my level for the health system, when it comes to vaccine introductions and others, as I've said earlier, whilst I'm part of it, some of my roles include budgeting for EPI logistics at the district level. I'm the lead person when it comes to those aspects. And so I'm expected to always ensure that vaccines and other logistics are available based on the target that I have for my people. And the other things that I'm also involved in is when it comes to coaching, I'm expected to ensure that vaccines are always maintained at their level, and also expect that the lower levels, they also buy into what the district is doing. And so for these two roles, it's very paramount for the new vaccines to be introduced to work very well. And what I'll find most challenging when these vaccines are introduced in my area or where I work right now, I will be looking at the cold chain space, because we know that these vaccines that are introduced, we need to keep it at a certain potency, and we need the refrigerators that will be able to keep them at that space. I'm looking at, will we be able to ensure that the vaccines are kept at that level? So that will be my main challenge that I'll be facing at my level right now. And maybe funding. I'm also looking at if the funding will be available for all the things that will need to be put in place. For respect to vaccine hesitancy, I'm sure that we will have issues when it comes to this particular hesitancy, because until now, when we just finished doing the OPV campaign recently, we had a lot of issues when it comes to caregivers accepting the OPV vaccines for their children. And we have a lot of people around. And some even linked that vaccine to COVID-19, that they thought it was for COVID-19, so they were never going to accept it for their children. So I'm looking at the aspect whereby we need to do a lot in order to ensure that we don't encounter any vaccinacy issues here. And so to prepare for that, for my area, mostly we have worked very well when we involve stakeholders like religious leaders, opinion leaders, and the rest, because the public have trust in them. They see them as their leaders. So we are going to work from that angle and ensure that when we bring these stakeholders on board, talk to them, have meetings with them, they are also going to help us so that we can roll out these vaccines very successfully. Thank you for the opportunity, Dr. Rida. I'm done. Over.
Thank you very much, Josephine Owusu-Yeboah. All right, before we go any further, we do have Dr. Francois Gass in the room with us. We're waiting for Susan Mckay. She is on her way. She has confirmed, and of course she'll get to see the recording. And so, if you have any questions, in addition to responding to the questions on screen, any concerns, any issues that you feel that are important to you to help make sense of this, what COVID-19 vaccine introduction is going to mean in your context, include that when you present. So we have now had presentations from Nigeria, India, and Ghana. So if you are from one of these three countries, please put your hand down. We're looking for to individuals from to hear from as many different country voices as possible. Francois, would you like to comment on what you have heard so far? Francois, are you able to speak to us? I don't know, maybe you're not. I'm going to ask you to unmute.
Yeah, no, hello to everyone, and thank you, Reda, for giving me the floor. But I'm just a careful listener, thinking of all the concrete, knowledge about what people are going to face when they introduce COVID, from the logistics to the vaccine hesitancy, to the way they intend to prevent, to the level of preparedness that obviously varies from one country to another. And I heard the need to communicate with the people that are trusted by communities, and I think it's a very, very interesting list of issues that will affect all countries in their context at a different level of magnitude, and it will be extremely useful to share in practice what's planned and how you intend to really overcome those issues, because they are all important, and they will all you will all face those issues. There will be some success, some failures, and we learn from you success or failures. I believe very much into your input in guiding global recommendations to assist all countries in the world based on your success and your failure, because there will be success, there will be failures, there will be a need to correct the failures, but I think we learn by doing. And for me, I'm really impressed to see how your experience on having introduced many vaccine is going to help you with that new vaccine. So looking forward to hear more.
Thank you, Francois. And of course, we'll be sharing this with interested partners. So here are the questions. Again, if you are from Nigeria, India, or Ghana, just to be fair to hear from as many countries as we can today, please do not raise your hand. And conversely, let's go to Jemima Tormu. Jemima, are you able to unmute? You have your hand raised. We would love to hear from you. Yes, go ahead, Jemima. You have your hand raised, so please unmute. And as I said, we're looking for contributors who are not from Nigeria, India, or Ghana, as we've heard presentations from these three countries. Jemima, you were unmuted before. And I also want to recognize...
Yeah, I'm from Ghana. I think we've already presented, so I don't need to do that again.
All right, thank you. And if it turns out we're short of presenters, we'll come back to you, Jemima, as well as you. But I believe we have people from many different countries in the room. So again, for the three of the largest scholar teams, of course, I'm pleased to see that you are amongst the first to present. If you are from a different country, please do raise your hand. We would love to hear from you. So let's go to Ali Abdul Hussein.
Yes.
Go ahead, Ali. Tell us which country you're from first, and then let's go to the questions.
Thank you for giving me this opportunity. I am from Iraq. I working with UNICEF. Actually, I already engaged in the more than vaccine introduction in the past, and the introduction of rota vaccine to the schedule of Iraq, and also monococcal vaccine. But what we're facing here, it is different, because in the introducing of the vaccine like rota. Sorry?
Dakane, please mute yourself.
Sorry. So introduction of the COVID, it is different from the previous one, because at the rota vaccine or even the monococcal, there is a group, a target group. It is less than what we have it in the COVID-19. I mean, I already engaged in this introduction, which is our group target is under 5 years. So the number is limited, and even how to convince the community, it is easier. Maybe this is my thinking, because all the community seeking for the health of their children, rather than the others. The others group. I want to talk about my country especially. And I found that maybe the challenges is the same as this that mentioned in previous countries, same as what we have and what we facing. This is the first one. It's maybe storage capacity. Is there is an if there is an available storage capacity to to put these vaccine in the minus 18 or below, and this is not available. I mean, this is the first time maybe for our country to seeking for or search for such a cold chain. So this is need because our country decide to use Pfizer vaccine in our country. And maybe this is the challenges. Other challenges, as I mentioned, I mentioned that this is the same for the countries. There is a religious leaders, and most of the people hear more from the religious more than the, for example, for doctor, even for prevention, the symptoms, side effect, everything. This is which is should be heard from the specialists, doctors, from professionals, but unfortunately here in Iraq, they hear more from the religious rather than the professional one. So maybe this is need on how to work with the religions and the leaders and how to convince them to send the messages to community in order to accept this vaccine in our country. Again, there is some people, some group of the people, they don't believe that there is such a virus. And they think this is, some of them, they think this is scientized in the lab. And this is, so they are not believe on the vaccine. This is maybe part of the group of our community. Also, we will face such a group and how to work with them. Maybe another challenges that we are facing here in our country, maybe because for the limitation that maybe our Ministry of Health, they decide to vaccinate only not all the people. I mean, not all the community. Target group, which is they put the priority for to vaccinate the medical staff and military staff, and also to vaccinate some of old ages with the chronic disease. This maybe create a sensitization between the community, because some of the community who are believe on this vaccine and want to take the vaccine after, if you are working with the community to convince them. So this maybe created some difficulties how to convince them. We are not going to give you vaccine while we give, for example, we will give your friend, but we will not give you. This is the main thing that I have in my mind. Thank you for giving this opportunity to hear from other countries and from my countries. But as I mentioned, maybe we are running in the same way, that the same challenges, same difficulties we facing all together. I hope we can work together and find some solution and support each other to end with the help community to vaccinate themselves. Thank you.
Thank you very much indeed, Ali Abdul Hussein, with a contribution from Iraq. So we have heard so far from 4 presenters, and so the operating principle is that we have one presentation for each country, recognizing that if you work in a health facility or in a district, we're not asking you to anticipate what's going to happen for the entire country. We only need you to describe what's happening in your context, where you work every day. I'm super pleased to see that Susan Mckay has been able to join us. Susan, a warm welcome to you, and I really appreciate the efforts you made to be able to attend at least part of this session. Would you like to unmute and?
Hi, Rena. Yes, I'm actually just walking back from the station, but obviously I was keen to join as soon as I can, because it looks like you're having an interesting discussion. So.
All right, we are, okay, I see there. Thank you, Susan. So we are going to, let me just turn off the screen sharing because there's at least one participant who knows that, how to turn on their screen share. All right, so we need another presenter. I saw that there was Amsalu Shifero from Ethiopia who offered to present. And I believe, Amsalu, you work at the national level. You're going to tell us. Amsalu, are you able to?
Yeah, thank you, Rada, for giving an opportunity. Can you hear me?
Yes, loud and clear.
Thank you. Yes, I have been involved in the new vaccine introduction in the past 4 to 5 years. For example, recently we have introduced the MCV2 and IPV. And the most challenges that we are facing were monitoring through, RAT, readiness assessment tool, particularly at subnational level. Collecting those readiness assessment tools from waradas and the zones, district and health facilities was a challenge. And logistic distribution was not also an easy task. We have a lot of community health workers, and the training of all health workers who are providing the service is not also an easy. We don't have the technology. Usually the training is provided face-to-face, and proper follow-up of adverse events following immunization, and tackling rumors was not an easy also. For example, while we were introducing IPV, there was rumor from some places that because girls are vaccinated for IPV, and it was said that this is to make infertile, girls will be infertile if they receive this vaccine. So such type of rumors was not easy to dispel. And it requires really a lot of efforts to disseminate appropriate message through media as well as interpersonal communication. So the second one is, we are planning to, we developed a proposal for COVID-19 vaccine introduction and rollout. And while we were developing a proposal, the most challenging was prioritizing at least the first 20%. We got the guidelines from WHO and adapted to the country context, including age, those people who have chronic illnesses, and we prioritize also health service providers as the first beneficiary. And we also included some of the refugees because they are living very crowdedly. So the prioritization was one of the issues that were discussed a lot while we were developing a proposal for COVID-19. My role is I am a member of the National Technical Working Group, and I participate on the regular meetings of technical working with technical working members for planning, for preparing guideline, for developing proposals, and monitoring the readiness status at subnational level and national level as well, and developing the materials for training the TOTs and trainers as well. So these are some of the issues that I am participating currently. The issue that the country will find the most challenging in order to introduce the COVID vaccine is, number one, I think the prioritization was a key issue, because particularly in urban areas, everybody requires vaccine, including teachers, military, students, health workers, those people who are serving in social service areas, people with other chronic illnesses, old people, and so on. So I think that was the most challenging. And the other challenge is, as I have mentioned in the first question, training of the health workers as well. And logistic distribution, because we are supposed to provide the initial or the first phase 20%, which is like around 22 million people. So vaccinating 22 million in 2 rounds is not an easy task. This is a huge, which will require to repurpose most of health workers to COVID vaccination and leaving the other essential health or health services, I mean, unattended. So these are the some of issues. What do you expect to face with respect to vaccine hesitancy? Yes, I feel that there will be mixing feeling. There will be demand, particularly from Urbanians and illiterate population, because everybody wants to be vaccinated. And at the same time, there will be a huge hesitation from the rural areas and religious population as well. So it will require definitely a lot of communication activities to convince those resistant groups, as well as to convince those Urbanians who need the vaccination in urban areas, and to convince with the prioritization criteria. Thank you, and over to you.
Thank you. Thank you very much indeed. So for this contribution from Ethiopia. So let me add Ethiopia to the board here. All right, we're at the 47th minute. We've heard from 5 countries. We know we have many more countries in the room. And just to clarify, I have one clarification and one question for Susan. So clarification in terms of who's in the room. So 338 Anglophones submitted a case study on vaccine hesitancy, and only that subset of people who actually put in the effort to develop a case study has been invited to this private session. It is not being live streamed because of the sensitive issues around COVID-19 vaccine introduction. So we want to be clear about that as well. And we are only going to hear from a few of the countries, but with Charlotte, we discussed it and we said, I was expecting around 20 or 30 people to... Bye-bye. That there's quite a significant interest. The second invitation for Susan is, if you are able to stay for maybe 5 to 10 minutes at the end when we finish the workshop in 12 minutes, then I would like to invite you to a live stream, which will be on LinkedIn, Facebook, Twitter, and so on. And just to ask you a few questions about the work you're doing at GAVI and how you see this question from the global level, as well as anything that you'd like to comment in terms of what you heard in the private discussion. So Susan, would you be able to stay for 5 to 10 minutes at the end of the workshop?
Yeah, I'll just try and organize something with a colleague, but I'm hoping so. I've just reached home, so I'm just going to run upstairs and join you properly in a couple of minutes.
Okay. Next, we'll be hearing from Martha Ngoe from Cameroon. So Martha, over to you.
Thank you, Reda. Hello, everyone. I'm Martha Ngoe from Cameroon. I work at a subnational level EPI, Ministry of Public Health. Yes, I've been involved in a new vaccine introduction. Recently, 2020 October, the country introduced a HPV vaccine. The most difficult challenge we had was hesitancy, because the parents of these young girls were targeting children 9 years, girls 9 years old. So the parents, they had this conception that the vaccine has come to render the girls infertile. So we had vaccine hesitancy from the community. Am I involved in the COVID-19 introduction in my country? I would say yes, indirectly, because as a country team leader, I am involved. I wish to say that after the exercise 1 of the COVID-19 peer hub, we put out some projects developed by scholars that had to do with the vaccine hesitancy and communication. And these projects have been integrated into the national action plan for the year 2021. And personally, again, I will be involved since I work at the EPI at the subnational level. For the deployment, yes, because I work at the logistics department, I think I am involved in it. So the micro planning counts a lot. What do I think my country will find most challenging? The most challenging part will be the hesitancy part, because first of all, my community does not believe that the COVID-19 disease does exist. So it will be meaningless for you to protect somebody with vaccines for a disease that the person does not believe that it exists. And lastly, what do I expect to face with respect to vaccine hesitancy? As I've been saying from the beginning of the presentation, we already know that we'll really have a hard time on this. And also demand on promotion. We will need this human resource also, because we are having another target group that is not within the EPI routine target group. So we will need them also to reinforce the human resource and to really talk on this vaccine to the community and really engage community health workers, although these people have already started doing some work. So how we are planning to face this is that we are really working on communication, target communication. That is our main priority for now, especially with the ideas or the projects pulled out from the Pair Hub Impact Accelerator, and also community engagement. More and more community health workers are being trained and targeted for communication. Thank you. Over.
Thank you very much indeed, Martha Ngoe from Cameroon. So let me add Cameroon to the list, and let's have one last. So just to explain, I believe this is the first, this is going to be big. You're probably one of the biggest global health challenges ever. And if you work in immunization, chances are you're going to be involved one way or another in the introduction of this vaccine. So this is only the first time we're explicitly talking about this topic. It is not the last time. So do not be disappointed if you do not get to speak today, or if someone from your country has already spoken. This is the start of a process. We're hoping to, we've reached out to Anne Lindstrand, who's the Global API coordinator at WHO, responsible for, on the WHO side, inviting her as well. And hope to have more workshops like this, and to be bringing the technical guidance, the expert guidance, so that you can prepare and position yourself really even before your Ministry of Health has asked you to do so. This is coming, and being a member of the Peer Hub gives you hopefully will give you food for thought and a way to be ready. Let's go to Bira Joy. So Bira Joy, you will be unfortunately much to the dismay of others in the room and to mine, probably our last presenter. Bira, are you able to unmute, please? Bira Joy, are you able? You have your hand raised, so you need to hit the unmute button. Let's go to Sabitu Sanusi. Seems to have a problem.
Hello, everyone. Hello, Raida. Can you hear me, sir?
Yes, loud and clear. Can you remind?
I am Sabitu Sanusi from Nigeria. My question is.
Sorry. Yes, you had a question. Yeah.
Is that can this vaccine of COVID-19 going to be shared protein immunization, or going to be a hazard campaign to those countries that are supposed to be using it, sir?
All right. Thank you for that question. I've asked Susan if we can stay over what we're going to do once we have finished hearing from countries, and we'll be sharing the recording, as Susan was unable to join us earlier, but we're grateful that she's here now. So we'll be going. We'll close the private workshop, and we'll do a 10, maybe 5 to 10 minute Q&A. So just a few questions, and we can certainly keep that one, Charlotte, if you can make a note of it. And we'll, if Susan is able to stay for a few more minutes, we will live stream the Q&A with her, so we can begin to share more on the public side. We straddle both. We want to make sure that sensitive issues can be discussed in private amongst members of the Peer Hub who have secured their employers' support to participate in the Peer Hub, who have made commitments to confidentiality and to Chatham House rules and so on. And then we also want to do something public facing to inform people who are not members of the Peer Hub. So that's a little bit convoluted, but I hope it's clear. Let's hear one last presentation. So if you are from Nigeria, India, Ghana, Iraq, Ethiopia, or Cameroon, we have already heard a presentation from your country. So really looking for someone who is not from any of the countries that are listed to answer the questions. So Bira Joy, yes, you have already raised your hand. You need to unmute, however. So you are able to unmute, but you need to, yes. Bira Joy, yes, please remind me what country you are from, please.
This is Bira Joy. I'm coming from Uganda. I'm the cold chain technician at the district level.
Thank you, Bira. The floor is.
Then I was saying, yes, this is Bira Joy from Uganda. The most challenge you are going to face at the district level, you're going to face a problem of teaching the lower health facilities on the new vaccine introduced. And what I know, there will be a vaccine hesitancy within the health workers, because most of them they are not able to give a vaccine without. Hello.
We hear you, Bira. Please proceed, and thank you for taking the floor.
Yes, the vaccine hesitancy is a must, because people do not believe that COVID-19 virus is within the country, and will not be allowed to get the vaccine because they are just there. They are moving with no masks, because for them, when you tell them COVID is within the country, they don't allow. Another thing, when the new vaccine is introduced, you find that it is received by only the medics, where everyone in the community needs to be vaccinated. And you find that even if you vaccinate only the medics, when the community people are not vaccinated, we are not running over the virus. Another thing, monitoring the vaccine utilization in the low facilities is still a problem in our country. You find that even if you give them the vaccines for the low facilities there, you find them, even if you give them the vaccine, monitoring them and utilizing them is a problem. So this is a problem within our facilities in Uganda. Another challenge I'm going to face as someone who works at the district, I don't know whether this vaccine will be a multiple dose vial policy, and the storage, the temperature at which the vaccine should be stored, whether it is the same as the one you are keeping at the vaccines, the common vaccines in our country. I have been involved in the introduction of new vaccines like HPV, hepatitis B, and rotavirus vaccine. So this was a problem of immunizing children in the low facilities, because many health workers could complain that the mothers are just complaining about the vaccine. So they never wanted their children to be immunized at the facility levels, because they find that every day they introduce a new vaccine and their children are being immunized. So they think the vaccine can bring some consequences to their children. That was my. Hello.
Yes, we heard you loud and clear, Bira Joy. Do you have any additional comments or questions for Susan Mckay from GAVI?
Yeah, the question I want to give the GAVI people. I want to know whether the vaccine will be a multiple vial policy, and whether the the question you want to give the GAVI people, I want to know whether the vaccine will be a multiple vial policy. Thank you, Mr. Radin.
All right. Thank you, Madam Bira Joy. Let's go to Susan. Would you like to quickly, are you able to quickly answer that?
So I'm not the right person to answer that question because I'm on the more of the demand side, but I will obviously make a note of that and come back to Bira Joy with the right answer. And obviously in this situation there are multiple different vaccines being introduced, and so it's absolutely vital that the correct information relates to the exact vaccine that's being introduced. Over.
Right. Thank you, Susan. So, Bira, we will follow up with Susan and her colleagues to try to bring you a reliable answer. Of course, your Ministry of Health should be able to answer to answer that. That is, but the superpower that you have is by being connected to the peer hub. You're connected to practitioners, others from Uganda, others from all over the world, and to the global partners. So I want to recognize the comments in the chat. There's some very good comments, and again, scholars supporting each other. Very much want to appreciate that as well. All right, we are now done with the workshop, and I just want to make sure, so we're going to, but again, this is only the first time that we're opening up the discussion and to try to understand within the peer hub, do we have people who are in fact developing their country's national vaccine deployment plan? Are there, what do you see, what is likely to be the most challenging? What's your experience with new vaccine introduction? Those are the initial questions that we wanted to ask members of the Peer Hub. Thank you so much for having participated in numbers way above and beyond what we had expected, I would say once again. So thank you. I invite you to stay on. Now, if Susan, are you able to stay for a few more minutes for quick Q&A? All right, so let me cue then the live stream, and we're going to do this. So you're welcome to stay in the Zoom room. As you know, many of you are now on our Facebook and LinkedIn and Twitter. So you're welcome to also follow there, where you can leave your comments and we can show them on screen. Let me see how we're going to do this. Yeah, let's cue the music. All right. For those of you who are just joining the live stream, a warm welcome from Geneva, Switzerland. I'm Rida Sadki. We'll be starting. We'll give everyone a couple of minutes to join the live stream. We're currently streaming on LinkedIn. So if you're on LinkedIn, leave us a comment, leave us a message so we know that you're there. And we are speaking with Susan Mckay from GAVI. Let me cue this up. Let me correct this. Here we go. And she works at GAVI specifically on this topic that has been keeping us busy, thinking about vaccine hesitancy, demand promotion, community engagement, and is of course involved in the global effort to get the COVID-19 vaccines ready for introduction across the world. I believe GAVI, the Vaccine Alliance, has announced that 2 billion doses should be made available by the end of 2021. A warm welcome to you, Susan.
Thanks for
all right.
It's delighted to be here.
Great. And we're here in the room with 105 currently members of the COVID-19 Peer Hub who've just completed case studies on vaccine hesitancy, who are right now peer reviewing them, and many of whom are involved in certainly thinking about what that COVID-19 vaccine introduction is going to look like. So we're going to do a short Q&A with Susan, and so we'll give everyone about a minute to get online and get on the live stream. Remember, we're looking at your comments and questions. Don't just say hello and tell us where you're from, but actually you can ask the questions you have about COVID-19 vaccine introduction and specifically Susan's area of specialty, which is around vaccine hesitancy, demand promotion, and community engagement. See you in a minute. All right, welcome. I'm Reza Sadki from the Geneva Learning Foundation. Thank you for joining us on this impromptu live stream. This was not planned, but that's just the way the world works, is when there is a need, when we're able to welcome Susan Mckay from GAVI, from the Vaccine Alliance. We just finished a 1-hour-long workshop working with national and subnational immunization staff from all over the world. We heard contributions from Nigeria, India, Ghana, Iraq, Ethiopia, Cameroon, and Uganda. Presenters shared wherever they sit in the health system, from the district, the health facility, or at the national level, how they are thinking about COVID-19 vaccine introduction, and especially this question: what do you expect to face with respect to vaccine hesitancy, demand promotion, and community engagement? How are you preparing to face this? So, of course, this discussion was private, but we're super pleased to have Susan Mckay stay with us now for a few minutes to answer some questions. We'll look for participant questions in the chat, questions on the live stream, and we're going to start with Charlotte and Boo's questions. She always has really good, meaty questions. Charlotte, over to you.
Thank you very much, Reda, and welcome to you, Susan. It's a pleasure to have you join us for today's impromptu live chat. So my first question to you is, what is GAVI's role in the COVID-19 vaccine rollout? You know, GAVI, the Vaccine Alliance, if you can say in just a few words.
Well, I think GAVI has been able to play quite a central role. I think many of you are aware of the establishing of the COVAX facility, and GAVI has stepped up to essentially make sure that vaccines are available to countries all around the world, and working very hard to make sure that this is a fair and transparent and process, so that it's not just going to be a question of vaccines going first to the richest countries. So I think we're very excited to be contributing to that goal.
In fact, Susan, the very first question from Okello Ogwal Hillary via Facebook is, why is planning COVID-19 vaccine introduction not started in other countries? Obviously, the headline has been about the first individuals receiving a COVID-19 vaccine in the United Kingdom. So that brings up the equity. What can you say? What's GAVI's position?
Planning is very much underway, and I think as soon as the plans became clear, that I know that all the alliance partners have been working really closely with countries to essentially this unprecedented vaccine introduction. And I think, as everybody that was in the last hour knows, there are many things that go into paving the way for that very first vaccine to arrive. And I think this is vaccines that have been developed at unprecedented speed and scale. So it's extremely exciting that the countries that were on the call today will be very soon actually receiving the very first vaccines to these countries. And as in years past, of course, it was literally years, if not decades, before some of the new and underutilized vaccines came in. So I think this is very much a global first.
Thank you, Susan. Back to you, Charlotte. What is your next question for Susan Mckay from GAVI?
Thank you, Susan, and thank you too, Reda. Just to say that I think the previous question was quite in line with the question I wanted to ask Susan, because we know GAVI has some countries of focus. in previous years, there are some countries of focus. So I was just wondering if with COVID-19, you're going to move from maybe the countries in which GAVI used to focus their activities to having a more global view, talking about equity, just like Reda mentioned a while ago.
Yes, and actually the COVAX facility has been made open to all, and countries were invited to become part of this global effort to procure and distribute vaccines in a more equitable fashion. So yes, it has meant that GAVI is working with countries that we don't normally work with, but I think that's bringing the world together in an exciting way.
Yeah, exactly. Thank you. My next question, so many of the experiences that we listened to a while ago, when it came to challenges, the main challenge that kept coming up was hesitancy, vaccine hesitancy. So I was wondering, is GAVI with other global partners actually working towards developing guidelines or new strategies on how to better communicate as far as rolling out the COVID vaccine is concerned?
Yeah, absolutely. Our partners, and led by UNICEF and WHO, but also CDC and many other organizations have been involved, and members of civil society as well. We have a demand working group who have been specifically working on guidance to get out to countries as quickly as possible, because we know that if we are to successfully roll out this vaccine to health workers as well as to the public, we will need to have trust and confidence in this vaccine introduction. So a lot has been happening behind the scenes, and there are many new aspects that we need to take care of. It's a vaccine that's going first to frontline workers and also high-risk populations. So this is not the usual work that we're doing for immunizing infants. So there are many aspects to take care of. But as I say, and also this is unusual in that normally when we're working in immunization, we're working with tried and tested vaccines that have a lot of years of experience. But whilst these vaccines, every effort has gone into ensuring that these vaccines are safe and have been properly tested. But obviously there are many unknown factors which does make this more challenging in this case. But I think, as you've already seen, that all the best procedures have been followed in this case, so that there's a high level of confidence in the vaccines that are being rolled out.
So Susan, I see in the room with us, we have people whose daily work is immunization from all levels of the health system in many different countries. And many of the questions I'm seeing in the chat are asking about the characteristics of the COVID-19 vaccines. You've already said before we went live, it's complicated. Can you tell us how currently someone who works in immunization, who's maybe is a little bit ahead of the game, whatever level of they work at, because they're participating in the peer hub, they're hearing about this before the news reaches them by other channels. What would be your advice on how they can get reliable, technically accurate information to answer those questions about the vaccines themselves?
Yeah, I think, and obviously, I think for those in the health system, that it really is about listening and keeping in touch with your colleagues in the national immunization programs who have the latest, most up-to-date information, who are working with all the experts, and to make sure that that's where credible information is going to come from. We're certainly, all the partners are working with the media to make sure that what is being communicated through the media is accurately reported, because it's absolutely vital. There's a lot of conversation out there. I don't think we've ever seen so much conversation about immunization and vaccines. But I think it's extremely important that people make sure that what they're listening to is coming from a credible source, that it's the most up-to-date information, and that if they have any concerns, that they ask questions and make sure that they are satisfied by the answers, because it's going to be extremely important with many different vaccines being introduced, that obviously it's not just about the information that's out there, it's making sure that you have the right information relating to the vaccine that will actually be coming to your country
I know Charlotte has many questions. We've got one from Adamu Abu Bakr from Nigeria, who says, who just gets to the point. How are GAVI and other partners going to help us to move from vaccine hesitancy to acceptance? Let me put the question.
Yes, absolutely. I think, the vaccines are, by the vast majority of people, widely accepted as a social norm. The people understand the value of vaccines and also the systems that go into developing them, regulating them, and delivering them. And it's one of those things. It's a bit like the airline industry, that there is a huge amount of effort, and that's the absolute primary concern. So it's that I think people are working day and night to make sure that this is a smooth introduction because of obviously the situation that we're in. But the partners, I think, I'm actually impressed by how much information is being made available, open and transparent, and that we are equipping frontline workers with the right information and the right skills and the right confidence to be able to reassure people that this is a very necessary exercise. And I think, if we've seen many of the people who've started to receive the vaccines, that there is a great sense of relief that we might be turning a corner, that the world has stepped up to this challenge, and that this is the start of helping to move forward from the pandemic.
Thank you, Susan. And back to you, Charlotte. I also see many questions from members of the Peer Hub in the chat. I hope
exactly, Reda. And I just wanted to, constantly, members of the Peer Hub are asking about the affordability of the vaccine for poor countries. And I just wanted to pick out this question from Salu Shifero from Ethiopia. He said, is cost affordable for poor countries, including operational and as well as co-financing as the vaccine is given for large target groups?
Yes, absolutely. A huge amount of effort has gone into making sure that this vaccine is affordable. And obviously that work is ongoing, and working through the GAVI mechanisms for the GAVI eligible countries. And so that was the primary concern, is that through the approach and the support of donors, that the vaccine needs to be rolled out worldwide, because the only way to keep the whole world safe is to make sure that the vaccine is available to all countries.
There's a very good question via Facebook from Aisiatou Laren, because Susan Mckay from GAVI, her specific area of expertise is around demand promotion. And Aisiatou Laren says, thanks for this workshop. What measures are being taken to protect and reassure populations, especially in sub-Saharan African countries that historically have been marginalized and are now generally distrustful of vaccines, according to Aisiatou?
So I think that the important thing to say is that in all parts of the world, there is, in terms of vaccines, there are almost 9 out of 10 children is actually vaccinated in the world. So it's really important to say that vaccines and immunization are widely accepted. But we do know that there are concerns, particularly spreading on social media, that have become quite well reported, and there can be localized concerns around immunization. But every effort is underway to make sure that the relationship between health systems and communities is strong, that health workers have the right information, that they're able to reassure parents. And obviously, I think the success of immunization globally also speaks for itself. So I think it's important. I think so important to focus on the positives and the widespread uptake and the success of the programs that do keep our children and adults safe day in, day out.
Thanks, Susan. The sheer number of questions shows to me that there's this kind of dialogue is something that will need to, extend beyond the 20 minutes that we're going to spend with Susan today. So back to you, Charlotte, for perhaps a final 1 or 2 questions, knowing that this is really hopefully the start of a conversation. And thank you, Susan Mckay, again from GAVI, from the Vaccine Alliance, for being willing to engage with this group of immunization staff, national, subnational, from all levels of the system, who are already thinking about COVID-19 vaccine introduction. Back to you, Charlotte.
Thank you, Reda. And just to say that still lots and lots of questions on the chat that we won't have time to look at, Susan. But there is one that keeps coming up, and I just wanted to pass it by you this afternoon. It has to do with the vaccine being rolled out. Would it be preferably a routine immunization or as campaign, or each country will adapt as per the various conditions available for them?
So obviously at the start of this introduction, as we know, that there are only limited quantities available, and countries are working hard to make sure those at highest risk, whether it be by their profession or by perhaps some of the either their age or health condition, will receive the vaccine. And so obviously these kind of introductions initially will be under a kind of campaign approach. But the answer is we don't yet know everything about these vaccines in terms of how long that they will give protection. We're obviously trying to get them to as many people as possible and ramping up production. But in terms of whether this will move over from being a campaign introduction into becoming a vaccine, more like a flu vaccine that, for example, that may either go into a routine program and may need to be repeated over time. These are questions that are still being worked out. So I think it's important that everyone on this call and in this group keeps abreast of the latest developments, because it is obviously a very dynamic and exciting space in terms of how everything is developing.
Thank you very much, Suzanne. Yes, I just wanted one final question. I was just thinking about an opposite scenario, Reda, in which that is the demand for the vaccine is so high, higher than the ability to supply. What kind of communication will be made available to ensure that people don't maybe get out of control, that are patient enough to wait?
Yeah, no, this is a very important question, because in fact, with many vaccines, and when we've seen outbreaks, for example, of meningitis or yellow fever, or in the cases of HPV, for example, where shortages of supply have meant that we've not been able to meet the demand for vaccines. And I think, if anything, working in the demand space, that the lack of supply can be as challenging as having too much supply, so and not enough people to take it. So I think what we're saying here is that building trust with health workers and with communities is absolutely at the center. That you need to communicate the right information at the right time to the right people, and also be honest, because whether being honest about the decisions that go into making who gets the vaccine first is absolutely vital, so that people understand the priorities and are respectful. Because I think underlying everything, in terms of immunization, is having trust in our governments, having trust in our health system in order. That's the foundation on which immunization is built. And so communication, being open, honest, and transparent is something that the health system really needs to focus on and get right.
Thank you very much, Susan.
And thank you, Charlotte. Charlotte and myself, Reda Sadki from the Geneva Learning Foundation. Thank you for having joined this impromptu live stream. Thank you, Susan Mckay from GAVI, for having joined as well. For Adamu Abubakar, who says, how are we going to get all the discussion? Well, stay tuned. Wherever you found us on Facebook, keep an eye on our Facebook page. You'll see more coming, and more invitations to workshops like this one. We're hoping this is just the beginning, and we're hoping that the Peer Hub members who've been working together, connecting more than 6,000 people from 90 countries, immunization staff from all levels of the system, that what you are, the experience that you have now of working together in these digitally connected ways can contribute to the challenge before us, which is to successfully introduce and scale up these vaccines to protect individuals and populations from the COVID-19, from the coronavirus. Thank you, Subhadip. And let's end with a round of applause for the immunization staff who, if they're not already getting ready for the COVID-19 vaccine, are soon going to be asked to do so by their ministries of health. Thank you, and see you soon. Keep an eye on our Facebook page. We'll now do a quick rewind of all the messages, or some of the messages received today. Thank you, and goodbye. Yes, for Grace Vici, we were not able to answer really technical questions about the vaccine. That is not Susan Mckay's specialized expertise. So even if she knows the answer, it would not be appropriate to ask her a question. But we will be continuing this dialogue so that you can find yourself the information for yourself and ask your Ministry of Health and receive the answers and support that you need. Bonjour à Taïrou Maradoum et à bientôt. Okay, once again, thank you, members of the Peer Hub. We're really actually discussing with, so we've stopped the live stream now, so we can have, again, the private conversation. We're hoping as early as next week to be able to do a workshop with some of the technical specialists from WHO headquarters in order to answer some of the, some of the more technical questions that you had. Susan's specialized area is focused on vaccine hesitancy. I hope you found this useful, and of course you can, and we definitely appreciate one of the best ways you can support the Peer Hub, and sort of spread the word, is by going on social media. So if you're on Facebook or LinkedIn or YouTube, to share with colleagues. So don't share with just anybody, but share with colleagues who can actually use the information if it was valuable, useful for you. It's a kind of superpower that you have, being wherever you work, being connected to fellow practitioners from all over the world. So we hope this workshop has been useful to you. Apologies for we had some difficulties with and Susan fortunately was able to join late. So we'll be sharing the recording with her and asking for her feedback for the presenters from Nigeria, India, Ghana, Iraq, Ethiopia, Cameroon, and Uganda. Whichever one she missed, she'll be able to watch the recording. Charlotte, any final thoughts, comments, reflections?
I just really wanted to thank the scholars, members of the Peer Hub that participated in the session today. Wonderful comments that I read in the chat. Wonderful feedback concerning the various responses that we got from peers, and also their own experiences in their own context. And I wanted to also especially thank Suzanne for accepting to stay with us and to answer our questions. And I'm just looking forward to another opportunity where we'll get to talk more about issues of vaccine hesitancy, especially with the rollout of the COVID-19. So I just think as things are evolving, that they'll be available to answer our questions on how everything is going to happen concretely. So thank you, Reda. Over.
Thank you, Charlotte. All right, that's it. We know you're busy, so we know you need to get back to work, but thank you for making time for this, and we hope you found it useful. We know you're also doing peer review, so if you haven't started yet on peer review, please do so as soon as you can. We know you're there. We know how challenging this period is with end-of-year reporting and other duties, but so many of you have managed to do it so far. So if you manage to submit your case study on time, don't miss the next step, and that's to do your 3 peer reviews. Thank you and goodbye.